Pregnancy with an IUD. Understanding the rare possibility pregnancy with an IUD. Understanding the rare possibility while remarkably effective, no birth control method is foolproof. Intrauterine devices, IUDs, known for their high efficacy, are sometimes associated with unintended pregnancies. However, it's crucial to understand that this is statistically rare, making IUDs a highly reliable choice for contraception. The American College of Obstetrics and Gynecologists, ACOG, underscores the IUD's effectiveness, stating that during the first year of use, fewer than 1 in 100 women using an IUD or implant experience pregnancy, a rate 20 times lower compared to pills, patches, or rings. This article delves into the rare instances where pregnancy can occur with an IUD, explores potential symptoms, and outlines crucial steps if you suspect you might be pregnant while using one. How can pregnancy occur with an IUD? An IUD is a small, T-shaped device implanted in the uterus to prevent pregnancy for several years. There are two types: hormonal IUDs that release progestin, effective for 3 to 7 years, and copper IUDs, hormone-free and lasting up to 10 years. Both primarily function by creating an environment hostile to sperm. While highly effective, these mechanisms can fail in a few specific circumstances. IUD expulsion. This occurs when the IUD shifts from its intended position in the uterus and may move towards the cervix or even out of the vagina. Affecting about 1 to 3% of IUD users annually, expulsion is more common after childbirth. Feelable strings attached to the IUD typically dangle into the vaginal canal. If these are absent or shortened, it could signal displacement. Irregular bleeding and discomfort may also accompany this issue. Unprotected sex before insertion. For copper IUDs, unprotected sex before insertion can lead to pregnancy because the copper won't be in place to prevent sperm from reaching the egg. Doctors often recommend IUD insertion during a menstrual period for 2 reasons. It reduces the chance of these pre-insertion encounters and makes insertion simpler due to an already dilated cervix. Exceeding recommended use time. While not directly causing failure, exceeding the FDA-approved timeframe for IUD use, 3 to 7 years for hormonal IUDs, up to 10 years for copper IUDs, might increase risk due to limited long-term study data. Recognizing pregnancy with an IUD. Signs of pregnancy with an IUD are indistinguishable from those experienced without one. Missed period, a primary indicator often prompting a pregnancy test. Tender, swollen breasts. Hormonal shifts early in pregnancy can cause breast discomfort and swelling. Nausea and vomiting, morning sickness, commonly occurring around week 6 of pregnancy, but can vary widely. Increased urination. Elevated progesterone levels can trigger frequent bathroom trips. Fatigue, a common early symptom due to increased progesterone production. If you suspect pregnancy while using an IUD, take a home pregnancy test and immediately consult your healthcare provider for confirmation and guidance. Pregnancy complications associated with an IUD. While IUDs don't directly increase the risk of ectopic pregnancy, where a fertilized egg implants outside the uterus, it is more likely if pregnancy does occur with an IUD in place. Ectopic pregnancy requires prompt medical attention as it can be life-threatening. Infection risk. Leaving an IUD in place during pregnancy increases the risk of infections in the amniotic sac and fluid surrounding the fetus, potentially leading to complications. Seeking medical care if pregnant with an IUD. Contact your gynecologist immediately if you suspect pregnancy while using an IUD. A pelvic exam with ultrasound will determine whether the pregnancy is intrauterine or ectopic and assess the IUD's position. In most cases, doctors aim to remove the IUD during early pregnancy to minimize risks of infection or complications. Preventing pregnancy while using an IUD. While IUDs are remarkably effective, some precautionary measures can be taken. Insertion timing. Having an IUD inserted during your period reduces the chance of unprotected sex before it's properly in place. Backup method. Consider using a backup method like condoms until your next menstrual cycle after insertion. Regular string checks. Frequently check for the presence and length of the IUD strings to ensure it remains in position. Conclusion: pregnancy while using an IUD is rare, but not impossible. It's crucial to understand the limited circumstances that can lead to this, recognize potential symptoms, and seek prompt medical attention if needed. Despite the possibility of pregnancy, IUDs remain a highly effective and safe choice for long-term contraception when used correctly.